Hello everyone, I'm Professor Vidya Venugopal from NIHR Global Health Center for Non-communicable disease and environmental change, located in Sri Ramchandra Institute of Higher Education in Chennai, India. We have been working in the area of climate change, heat and health for the past decade and more, and we are kind of considered as leaders in the area of heat in the region, Southeast Asia, and elsewhere as well. We have conducted multiple projects in the area of heat and health, on workers, on communities, and school children as well, and kind of generated evidence for policy changes. I am going to be discussing today about the intersection of environmental change and non-communicable diseases. Climate change has been a buzzword for a few decades now, but the word health has been added to this buzzword, climate change and health, in the last decade or so. And it just makes much more sense to have this word along, because it's climate change is not only making changes in the environment, but also on the health of the communities which are exposed to it. So it is very important, and I'm very highly delighted to give this lecture. We will be seeing in the next slide the global trends that has happened when it comes to the temperature changes. For example, in 1950, the frequency and intensity of heat extremes have primarily been due to human-caused emissions of greenhouse gases. Here you're seeing Earth just experienced the warmest year on the record between the years 1897 to 1901. It's self-explanatory. So the world has been tracking, the scientists have been tracking about climate more, but less on the health part, which is currently happening. And for example, the years 2016 and 2020 are tied for the warmest year on the record. And any environmental change, any climate change, any changes in heat levels have an impact on the health, because heat is the basis behind the thermoregulatory mechanism of any living organism. We can say that the temperature is actually distribution is actually shifting more towards the heat part, and then we ever say it was cold and then it's average, now it's getting hotter and hottest, especially in the tropical regions, that the impact is much higher compared to the non-tropical regions. And the daily mortality, the slide shows the daily mortality in May 2010 that has happened in Ahmedabad city, which was actually graphically represented here. And the first few states in India that were working on heat-related mortality and morbidity and health were Ahmedabad, the IIPH, and we can see once in 200 years kind of heat wave called Southeast Asia, and the climate change will make this a little bit more common. Means all these climate events, the extreme heats, the number of days the temperatures are going to be higher than the average, the warmer nights, everything is going to be a little bit more common when it comes to Southeast Asia. I come from India, and what are the heat impacts in India? We see, like in March, April 2022, which was just like about 1.5 years back, India and Pakistan experienced heat wave 30 times more likely to have happened because of climate change. And Gujarat, the state that I was speaking about, Ahmedabad, They are reporting a rate of highest rate of heat ailments in India. And one of the things that we need to say, other states might not have documented the heat-related illnesses, which is also that the data gaps are there in any country for that matter. And Gujarat reports a greater number of HRIs among the states, according to 82% of all the reported cases. Like I said, it's all about data gaps as well. Maharashtra, heat stroke deaths, the critical factor of humidity. So when there is heat and humidity, Maharashtra, there is a lot of coastal zones nearby. So there is like heat and humidity together was a killer for them. April 2023, there was an open air ceremony in Mumbai. 13 people died due to heat stroke and 600 people were admitted in the hospital, and the humidity was pretty high there too. June 2019, more than 100 heat-related deaths were reported from the districts of Bihar. Chennai, where I come from, Chennai scorching summer gets hotter and hotter, and then people are impacted. There have been recordings that have happened because of people impacted by heat. So the story goes on. So what is heat wave? Okay, just to give a definition, heat wave is a period of abnormally high temperatures, more than the normal maximum temperature that occurs during the summer season of India. Heat waves typically occur between March and June. That was what was happening. But now we are having heat waves even in July, not so much in August, but in July in the southern regions. The Indian Meteorological Department, IMD, has given a criteria for heat waves. Heat wave need not be considered till maximum temperature of a station reaches at least 40 degrees in the plains or at least 30 degrees for the hilly regions. When the normal maximum temperature of the station is less than or equal to 40, heat wave departure from the normal is 5 to 6 degrees, and severe heat wave departure from normal is 7 degrees or more. So you have a normal temperature, an average temperature, and if it departs 5 to 6 degree or 7 degree more, then it is considered as a heat wave. We will look at a little bit of a global picture. About approximately 15,000 people died in the year 2022 due to heat, right? And about 4,000 people in Spain, 1,000 in Portugal, 3,200 in UK, 4,500 in Germany. All of these are European countries, and they are not even tropical countries like us. Heat-related deaths increased by 68% in populations above 65. 65 ailments such as acute kidney injury, heat stroke, cardiovascular, all these were reported by Lancet. For the past 50 years, about 1.5 lakhs lives are lost in the European countries due to extreme temperatures. 1.48 thousand lives have been lost because of this is reported by WHO. And every year, about 17 million people under the age of 70 die of NCDs, and 86% of them live in low and middle income countries. This is again something is reported by WHO. So you can see there is kind of somewhere that overlap is happening. So what is exactly the impact of heat on health system? It not only affects the health of the people, but also it becomes a burden on the health system. We will discuss a little bit more about that. Let's understand the pathophysiology of heat. So usually when a person is exposed to heat, there is an usual increase in skin temperature, and there is an increased skin blood flow that happens. That is because of the venous pooling that happens, and there is an increase in core body temperature. And then to combat the core body temperature rise, the heart sends the blood to the skin area, the extremities. So that is why you have the increased skin blood flow and the venous pooling. Decreased venous return happens. Further venous pooling happens if the person is more exposed, and especially if the person is exercising as well. So that causes increased heat load inside the body. So when just to compensate for that, there is a vasoconstriction that happens, And then and when there is a decreased venous return, there is a compensatory tachycardia that also happens. Again, further venous pooling, again hypotension happens, cutaneous vasoconstriction, and then it increases the heat load inside the body. So this is the basic physiology for anybody who is exposed to heat. So when it is a little bit more special for workers or people who are exercising in heat, a person who is running, and sports person who is doing a marathon run, or a worker who is working outside, we can call it an exercise, or a person who is like walking, and a common man who is walking fast with some heavy workload. There are two things that impact heat when it comes to a working person. One is the high occupational heat stress, the exposure that you have. Second is the heavy workload that the person has. Occupational heat exposure and the incidence of chronic kidney disease has been something that has been in the buzz right now. Many people in Central America, people who are working, people in agricultural settings, people in salt pans, people who are in big kilns, they have been exposed to heat stress. And then we have seen higher prevalences of chronic kidney disease in these populations. So what exactly happens? There is a rise in core body temperature happens when a person is exposed to heat plus also the heavy workload. And high urine specific gravity happens because of repetitive dehydration, and then excessive sweating and thirst happens. And the person, because of repetitive dehydration, repetitive kidney injury, also happens a repetitive kidney injury. Sometimes because of non-compensatory mechanism in fluid intake, there is also renal calculi formation that happens. Urea crystals kind of crystallizes out, and then the body starts to make renal calculi. Apart from that, other renal complications happen because of the repetitive kidney injury. Things like acute kidney injury could happen, and if this happens for a longer time, then you also end up having chronic kidney disease. Heat stress has different impacts on different groups, especially the vulnerable groups I would like to highlight. For example, children, they have the thermoregulatory system is not completely developed, and the adaptive capacity is compromised. Education is disrupted. Aggressive behavior can happen because of heat. Adjustment disorders can happen because of heat, and that is something that we have commonly seen during heat. Children go play out in the heat and come back, and then they are like irritated and all of that. This is just not science. This is something that physiologically happens inside a child. And then when it comes to worker groups, I've already spoken about worker groups a little bit. Heat has impacts, more adverse impacts on workers, because they have two kind of exposures. One is the heat exposure from the environmental factors. Second is the metabolic workload, because of they are exercising and working in the heat. This could lead to heat-related cognitive impairments that in case could lead to accidents, HRI stress, and even depression. We have heard of suicides and suicidal ideation in workers because of heat. There have been studies done about the suicides that have happened, or the intention to suicide because of heat exposures. There have been studies that have associated both. Apart from that, pregnant women. Recently, we published a paper in British Journal of Obstetric and Gynecology about how pregnant women are impacted by heat. And we have seen there are changes that happen in a woman's body, apart from, and the consequences of heat exposures, excess heat exposures on this woman. Could lead to spontaneous abortions. It could lead to low birth weight of the children. So they have a lot of negative consequences because of heat. And it becomes even more stress and anxiety in these women. And many of them could not even spend for their medical expenses because of their conditions. And elderly people with comorbidities, acute conditions are exacerbated, and then comorbid conditions aggravate the diseases because of heat exposures. And other important group that we all need to start focusing on, the climate migrants. Migrants who move because they are not able to it could be because of climate, or it could be because people are going and looking for work. Many of the agricultural workers across the world have started moving out because they are not able to manage the climate thing. Because of economic reasons, they move out too. So migrants are somebody who are affected the most as well. So how does heat have an impact on the NCDs? Based on what little science I told earlier about what exactly happens in the body because of exposures to heat, people are impacted. Diabetes mellitus and hypertension are on the rise because of heat exposures. Mental health changes. People are exposed because of increases because of heat. Cardiovascular diseases, chronic kidney diseases, and malnutrition. People do not get enough food, or people are impacted by all these diseases, and that causes malnutrition as well. Primarily cardiovascular diseases, cancer, diabetes, and chronic respiratory disease are about 74% of the deaths in the world, including 8 million deaths linked to unhealthy diets. So heat has an impact on all of this as well. So there are different types of impacts that heat has. We always speak about the direct impacts, right? Heat-related illnesses, accident, death from respiratory diseases. It exacerbates respiratory diseases, hospitalization, and all of that. But the indirect impacts of heat are sometimes kind of ignored, and impact on health services. There is increased ambulance call-outs and slower response times. Increased number of hospital admissions, storage of medications, foods perishing. Forget about the medicines, but the food perishing. So health services are burdened a little bit more during heat waves and any climate extreme events. Increased risk of accidents. People could drown because they kind of pass out. Work-related accidents could happen. Injuries and poisonings could happen. And all of this could actually go and impact the insurance system and the health system as well. Increased transmission of food and waterborne diseases could happen because of heat during hot seasons, and seasons following that. You can see an increase in vector-borne diseases and marine algal blooms. So that also has an impact on the health of people who are located nearby. Potential disruption of infrastructure, right? Many times I would say many people that you might have the equipment, but you need the power to do it. So there might be disruption in power, water, transportation, and also productivity of the workers, productivity of the country, and also GDP losses as well. There is an urgency to act because heat stress will worse with the climate change, because those who have suffered the most or the least privilege in the society, and because it can be partly prevented. These are not my words, but my mentor, Professor Todd Kellstrom, and a heat expert and a heat expert guru. And next one is like Kirk Smith. He says the rich will find the world to be more expensive, inconvenient, uncomfortable, disrupted, and colorless, in general more unpleasant and unpredictable. The poor will just die. And these are the worst consequences that can happen because of heat and climate change. Publications have been, the evidence has been generated by us and by few others, but there is a need for action with or without evidence, because there is an urgency to act on this right now. One of the solutions that we can have is heat action plans, and heat action plan is basically to reduce the heat wave deaths in India, what we have in India, that I would say. So a few things that we need to do when it comes to heat managing is like we need to adapt, we need to mitigate, and then we need to move on in a manner that would not impact the health of the people, correct? So reduction of heat wave deaths in India to zero has been a vision adopted by the present government, and the vision is followed since 2015. Okay, so what do we have in our heat action plan? We want to understand the disaster risk. We want to strengthen the disaster risk governance to manage the disasters. We have to invest in disaster risk reduction for resilience, and we have to enhance disaster preparedness for effective response, and two for the heat disasters, and build back better in recovery, rehabilitation, reconstruction under the Sendai framework for disaster risk reduction. This is what like India's heat action plan aims to. Let me tell you the key features of HAP considering the time constraints that we have. Heat early warning system, public understanding and communication, capacity building and providing cool roofs as much as possible, especially in rural areas. And HAP organized into three distinct phases, which aims to safeguard the well-being of the citizens during the pre-heat wave season, where public understanding and communication would be like the highest. And then during the heat wave season, early warning systems and provide cool roofs, and then post heat wave season giving more capacity building pre and post as well. If we do not want to adapt to the HAPs, there will be definitely health impacts, there will be economic costs that I spoke about, migration and displacement could happen, national security concerns could happen, social disparities can happen, and infrastructure strain, just not only on the health system but on everything. There could be more heat related deaths, more mortality rates in vulnerable populations especially. So adapting to heat action plans is one of the best things that India can follow. Housing and infrastructure changes could happen. Instead of using metal sheets, asbestos, thermally conducting thing, cooler concrete and traditional roofing could be recommended. Ensuring proper ventilation inside the house, acclimatization, especially for migrants from lower temperate weather conditions, and cooking in separate kitchen because that also generates heat inside the homes. Avoiding wood or charcoal, but using less heat generating processes like LPG or electric stoves. Personal protection. Avoid exposures to direct sun, exercise regularly, staying fit. People who are fit have less impacts because of heat. Smoking and alcohol consumption, they kind of are core risks for heat exposures. Using sun protective clothing as much as possible. Wearing light colored clothing, consumption of traditional fruits, seasonal fruits, fruits with a lot of water, and then hydrating themselves, staying home and traveling outside only when it is required. Occupational settings, they require a different set of working conditions. They require different set of recommendations. Avoid direct exposure to the heat source. Reduce exposure by job rotation. Proper and adequate work schedules, which is very, very important. Provide and use of appropriate PPEs. Provision of toilet and welfare facilities, hydration facilities, education and awareness to the workers by the employers, body and extreme cooling, how they can cool themselves, proper hydration practices, recognizing the signs and symptoms of heat, and then type of clothing to be worn while they are exposed to heat. And then administrative controls like job rotations, queue timings. People can be working during the non-hot times. And then periodic medical surveillance is needed and necessary action to be taken for the affected individuals. Green initiatives and sustained energy supply. That's very, very important too. And we have some examples of indoor interventions in workplaces. I've also given some examples of outreach and educational awareness that can happen, especially in rural areas where people are not very much aware about how they can protect themselves from heat. Not only that, from indoor places where people can be benefited by health awareness and education. Sustainable resilient plans. We are only speaking about adaptation, but we are not speaking about mitigation. What can we do to mitigate heat, right? Urban green spaces for the communities. People can be using more green spaces, like they can have green roofs and stuff like that. And water bodies such as ponds, canals can have thermally cooling effect. So having more water bodies in local areas would help. And then switching to renewable energy reduces the emission of CO2. Just not only does it give sustained energy, but it also gives it also reduces emissions. Strengthening the health system. We are in the era of climate change, and then if things are going to happen, heat is increasing, so the health system needs to be definitely prepared. Hospital preparedness and mitigation measures for all healthcare centers, that is a very primary key thing that needs to be done. Formulation of schemes and programs for heat health and safety. People need to be trained on all of these. There should be a monitoring mechanism for heat health preparedness at a state and a district level, which is already happening in Indian condition. Preparedness for heat health and social care system, how the social system can actually help protect these people. Create sufficient heat health facilities, facilities centered and adequate provision of basic medicines like ORS and glucose, just not the primary healthcare centers, but also public centers, cooling centers. All of this is very important. So, what is a way forward for us? Adaptation, protection, preparedness, and also generating evidence for policies. That's very, very important. Thank you very much.